Hi everyone, my name is Dr. Blair O'Neill. I'm an interventional and preventative cardiologist in Edmonton, Alberta, Canada. I'm a professor of medicine at the University of Alberta, and I've been past president of the Canadian Cardiovascular Society, which actually is the equivalent of the American College of Cardiology in the US and the European Society of Cardiology in the EU. I want to talk to you today about a talk I've cutely titled, Have We Been Led Down the Garden Path? The Skinny on Low Carbohydrate Diets. I'm going to describe my journey because I think a lot of healthcare professionals, such as myself, really experience this and can't unsee the results of a low carbohydrate lifestyle. So I'm obviously in my late 50s, have been active all of my life, get up at 5 a.m. and exercise because I love it. I tried to follow the standard guidelines, which in Canada are the same as all Western countries, which are, low fat, avoid saturated fat. And obviously when you reduce your fat intake, you have to replace it with some other macronutrient, and that typically is carbohydrates. And even when you avoid more processed forms of carbohydrates, the percent of that macronutrient goes up. And so probably not unfamiliar to many of you, over time, and particularly as I entered my late 50s, maybe 1 or 2 pounds a year, I slowly gained weight and actually went on a family trip, and my dear sister-in-law sent some pictures of that family trip, and it really struck me because I clearly had a problem in my midsection, and I knew my weight had been slowly increasing. And typical, I was quite disgusted with myself. And obviously, as a cardiologist who likes to practice what they preach, likes to practice preventative cardiology, I was not very happy. Just happened that I met a close friend who I hadn't seen in a while and who had obviously lost weight. And I asked them what they had done, and they said ketogenic diet. And typical of many physicians, I had no idea what he was talking about because most doctors are not really trained in nutrition. Certainly the nutrition that I knew, I had picked up from dietitians that I'd worked with over the years, and so hence the low-fat lifestyle that I was practicing, and obviously not winning the battle of the bulge against. And Mohammed bought me my first textbook in ketogenic diet. I assure you now I have a huge library and have reviewed much of the literature, and I'm an evidence-based cardiologist, and I have come to believe in this, and certainly as I practiced a low carbohydrate lifestyle, lost close to 30 pounds in the first 6 months and have kept it off, and I don't exercise nearly as hard as I used to. And I know that's going to be very familiar to many of you because many of you have experienced a low carbohydrate lifestyle. So what have I learned from this? Well, certainly a major thing I've learned is this business of calories in, calories out balance really doesn't make sense. And certainly exercising to reduce your weight doesn't make sense. There are a lot of good reasons to do exercise. It maintains mental health, it maintains strength, flexibility as one ages. And so there's lots of good reasons to do exercise. It just happens to be that weight loss on a sustained basis isn't one of them. Calorie reduction doesn't work. All it does is leave you hungry and miserable, but your body, you can't outsmart it. With calorie reduction, your basal metabolic rate just slows down. Reduce your calories by 20%, your basal metabolic rate goes down by 20%. So you start with some weight loss, it plateaus, you get frustrated, you start eating the same old things again, and you yo-yo, very classic. And the most fundamental thing, though, is learning and convincing myself from the literature that fat is not bad. Fat is not to be feared. In fact, fat is an essential macronutrient that makes lifestyle very easy because one loses weight because fat satiates you. You tend to eat 200 to 300 calories less a day, but your body doesn't feel it and so doesn't slow down its metabolic rate. and you lose weight without experiencing hunger and frustration. So how did we get here? Certainly in the 1960s, it was a very reasonable hypothesis that fat clogged your arteries led to heart attacks. Certainly the incidence of heart attacks was going up in the 1960s. And you have to remember, at the time, nobody was putting together the fact that everybody was smoking. After the Second World War, when all the GIs came home with cigarettes, everybody smoked, probably 70% of the population, but it wasn't immediately apparent, and certainly the tobacco industry certainly tried to keep that belief alive that smoking wasn't harmful. Well, likely the reason for the increased rate of heart attacks was smoking and the prevalence of smoking in society. But fat was a reasonable hypothesis. The problem is it's been tested many times. The scientist who advanced this, Ansel Keys, actually probably did the definitive study in this, called the Minnesota coronary experiment, in the late 1960s, early 1970s, which basically took patients institutionalized in mental institutions or in prisons in Minnesota, fed them a very well-controlled diet of vegetable oils, replacing saturated fat at the time. Of course, you could actually do that in a controlled environment, and then that was compared to people on the outside who ate the standard diet, which at that time was probably about 45% fat, less than 40% carbohydrates. And lo and behold, that study was finished about 1973. What it showed was that despite the fact that cholesterol decreased with vegetable oils, actually mortality from heart disease went in the wrong direction. The investigators didn't believe the results, never published it. And the results, the old computer tapes were found recently, and the results were published in the British Medical Journal in 2016. And so had that study been published in the early 1970s, we probably wouldn't have adopted the guidelines that we ended up adopting. So what's the evidence against fat? Well, certainly a very capable researcher, Zoe Harcombe from the UK, did her PhD in this area, and she looked at a meta-analysis of randomized control clinical trials. The gold standard, most nutritional science, is based on association, based on epidemiology. Dr. Harcombe, however, looked at meta-analysis, randomized control trials, many of those familiar, Framingham, Honolulu Heart Study, the Minnesota coronary experiment, and basically showed that fat was not harmful, wasn't protective, wasn't harmful. But if you decide to take fat out of your food guidelines and replace it with carbohydrates, there may be unintended consequences. And indeed, we've seen those, because since the guidelines were adopted with the first National Cholesterol Education Program in the 1980s, that's when the obesity epidemic really got started. And before that, obesity really wasn't a problem in the population. Its related complications, type 2 diabetes, really wasn't a problem in the population. Probably in the 1960s, type 2 diabetes probably only affected 1% to 2% of the population. Now look at our prevalence maps across the Western world. It's over 10%, and in subpopulations in Canada, for instance, we have fairly large Indigenous populations, and up to 20% of those populations have type 2 diabetes related to the carbohydrate intolerance of their diets. I can't not be a Canadian, not talk about a topic from a Canadian center. The PURE study was done out of McMaster University, out of the Population Health Research Institute. Dr. Salim Yusuf, a world-renowned cardiologist, and Dr. Andrew Mente, who led that trial. Basically, it was an epidemiological study. It was carried out in about 18 countries around the world, urban, rural communities. Canada was one of those countries, but a lot of third world countries were represented there. They basically followed over 135,000 patients, looked at their dietary records, but also in a fair number of these patients, about 100,000 of them, they measured their lipid profiles as well. And what they showed was that they looked at quartiles, or quintiles, I should say, of carbohydrate intake from the least to the highest, as well as fat intake from the least to the highest. Looked at what happened to cholesterol. So we know patients who go on a high-fat diet, low-carbohydrate diet, often do see their LDL increase, and certainly the investigators reported that as the fat intake increased, the LDL, the bad cholesterol, as we have traditionally known it, does increase. And however, the good cholesterol, so-called HDL cholesterol, with a high-fat diet actually increases 10 to 15%. One of the things that's more closely correlated with outcomes, more than LDL cholesterol, is the ratio of the total cholesterol to the good cholesterol, the HDL cholesterol. And that ratio also, as fat intake increased, tended to go down. And so that would be a favorable thing. And obviously the biggest impact was on triglycerides, fatty acids in the blood. And as triglycerides go up, we know that's associated with insulin resistance and with type 2 diabetes, and that triglycerides plummet on a high-fat diet. Look at as carbohydrate intake increases, well, the LDL comes down. That should be a good thing. However, we're going to talk about the mortality in a few minutes. And the HDL level, however, goes down. The good cholesterol goes down. So how is that going to weigh out? The total cholesterol to HDL ratio also tends to go up. So that, again, would portend perhaps a less optimal outcome. And triglycerides also tend to go up as carbohydrate intake increased in that population. And of course, what we're all interested in is the mortality rate. Well, curiously, actually, cardiovascular death was not different with high fat versus high carbohydrate intake. However, non-cardiovascular mortality, total mortality, actually went down with increased fat intake, but it went up significantly between the lowest quintile of carbohydrate intake versus the highest quintile of carbohydrate intake, probably about a 36% increase in non-CV death. And we know obesity last year was recognized as a risk factor for cancer by the World Health Organization, and one wonders if this is the cause of mortality. Unfortunately, this study was not able to look at the actual causes of death other than classifying as cardiovascular, non-cardiovascular. But certainly from a mortality standpoint, message was clear by association. The higher the carbohydrate intake of a particular community, the worse the total non-CV mortality. The higher the fat intake, the better the non-CV mortality. Pretty striking stuff. What about randomized controlled trials in this area? And there actually have been several. And one of them was a very expensive trial done by the National Institutes of Health, probably $700 million study in women. Over 47,000 women were enrolled in that trial, comparing a low-fat diet versus a control diet. This study was negative. It did not show a demonstrable benefit from undertaking a low-fat trial. I remember as a resident studying about the Mr. Fit trial, obviously all men, but over 100,000. And again, it was looking at low fat versus standard diet at the time, no difference. And of course, the explanation was that patients were not compliant. The explanation was that the control population was also falling low fat and we couldn't measure it, and that likely explained the difference. We couldn't accept the fact that maybe low fat isn't a good lifestyle. Maybe low fat doesn't reduce mortality rate. So we have this evidence that low fat diets just don't seem to make a difference in cardiovascular outcome. The diet heart hypothesis seems to unravel. And as I said, with the Minnesota coronary experiment done in the early 60s, probably it failed early. We just didn't acknowledge that fact because we were locked into the hypothesis that eating fat leads to high cholesterol, leads to increased cardiovascular mortality, but increasingly that's not becoming apparent. So what about low carbohydrate diet? What's the evidence for them? We don't really have long-term outcome studies, meaning, showing improvement in cardiovascular or non-cardiovascular outcomes, but certainly from a weight loss perspective, from things like measures of inflammation in the bloodstream, and we believe many of the chronic diseases of our time are related to inflammatory markers and inflammation in our body, be it cardiovascular disease, be it stiff hearts that lead to heart failure. So low carbohydrates diets have been compared to low-fat diets a number of times, probably at least 72 that I'm aware of. 2 of those were equivalent. A number of them showed a slight superiority of a low-fat diet, but not statistically significant. And remember, statistically significant means that we would get that result only 5 times out of 100 if it was accidental. But the low carbohydrate diet was actually statistically significantly better. So in other words, 95% probability that 37 times versus 0 times with low fat would this be an error. So low carbohydrate diets, 37 to 0, one could say, if one was doing a scorecard, as far as not supporting the evidence that low fat is actually beneficial. So weight loss certainly is better, and there are other markers of health that get better. What happens to lipids? Again, people worry that if they take fat, their cholesterol is going to go up. Well, probably about 50% of the time, the LDL cholesterol does go up, and that does cause people alarm. The other thing that goes up, and we've been looking for the magic bullet to increase good cholesterol, HDL cholesterol, it goes up more effectively than probably any other treatment, 10 to 15% increase in HDL cholesterol. The other thing that happens, because triglycerides drop so precipitously, because you get rid of insulin resistance that leads to higher production of triglycerides, the LDL changes its form. It becomes so-called soft, fluffy. LDL is a lipid particle, has to be carried in the blood with a lipoprotein to allow it to dissolve. Well, that soft, fluffy nature actually means that it is less harmful. When triglycerides actually go up in the insulin-resistant patient, actually LDL takes on a totally different form, so-called small, dense LDL, which almost become like bullets to the endothelium, damaging the endothelium, causing the body to react to that, macrophages to migrate in and initially lead to cholesterol plaque formation. So the evidence for low carbohydrate diets having a beneficial effect on weight, having a beneficial effect on other metrics of health are quite striking. And those are the lessons that I've learned from undertaking my low carbohydrate lifestyle. I've learned that one must embrace fat. One shouldn't fear fat. It's a tough, initially, it is a tough concept because it's been ingrained in us for so long. It's supported by guidelines that really are not evidence-based. It's supported by a food industry that benefits from high sugar, high carbohydrate meals. And basically, it is tried and true. So I hope that I am able to convince anyone who has any doubts, as a cardiologist who treats patients in the cath lab who are having heart attacks, that I truly believe this. In fact, it's quite disheartening, and I've experienced it coming in at 2 a.m., opening up a vessel. Patient obviously has type 2 diabetes. I come in to do CC rounds in the morning. They have a fruit cup, they have orange juice, they have whole wheat bread because that's healthy, they have oatmeal, and I know I have my work cut out for me in order to prevent and manage their chronic disease process. So what are the secrets to engaging this? Certainly there are a lot of resources on the internet, many good, there are some less good. I think support is helpful, looking for low-carb support groups on the internet, looking for a good health coach that is familiar with the low-carbohydrate lifestyle. I think those are keys to success. We know there are some pitfalls. For instance, if you increase your fat intake and you don't decrease your carbohydrate intake, then that can be a double whammy, that you can actually increase your weight and make your health markers less optimal. So those are the things that you need to do. There are signs of whether or not you are getting enough fat. For instance, the beauty of a low-carb diet is no hunger. And if you are feeling hungry, likely means that you are not getting enough fat, and you need to look at your intake to see, are you sneaking in carbohydrates that you're not aware of? But as I said, there are resources on the web. There are resources that you can seek out, experts who have embraced this lifestyle who can help you. But I sincerely really believe that this is the healthiest lifestyle that one can engage in, and I hope that you do too, and I hope that you don't struggle with it. I have a website with my wife, who is a certified health coach. It's www.ketocule.com. I'd love to hear from you about the content of this webcast, and certainly we'd love to help folks with tips and tricks that we've learned personally, as well as with clients that we've managed to help. It's an amazing thing when people tell you about how their life has been changed forever, how much more energy they have, how much more focus they have, and of course, how good they look. So I hope you've enjoyed this webcast. Look forward to hearing from some of you over time, but have a great day and a better weekend. Take care. Bye-bye for now.